Hello, everyone. This is Emily from Fort Worth Moms, and I'm very excited to be hosting another panel discussion. I think these are becoming one of my favorite things that Fort Worth Moms is doing lately. And today we are discussing a really interesting topic. It is oral health for children, and things that pop into our mind, teeth brushing, that kind of thing. We are going to talk about that, but we're really trying to take a deep dive into this topic. So I found some fabulous experts here local to Fort Worth, and I'm going to get to ask them all of my questions and some of yours too. And we get to hear their answers right here live today. So I am going to let them introduce themselves and kind of give just some information about their business and what they do. And I will start with my friend Karen. Please tell us a little bit about yourself.
Hi, I'm Karen Peters, and I'm a speech language pathologist at Monkey Mouse Pediatric Therapy. I have about 20 years of experience working with kids of all ages. I work with kids with feeding difficulties, which can go along with oral health, as well as articulation issues, language issues. Monkey Mouse is a therapy provider. We provide speech therapy, occupational therapy, audiology around the Dallas-Fort Worth area, but we've got an office in Fort Worth, in Hurst, South Lake, Capel, Frisco. We've got several around. And so that's a little bit about me and about Monkey Mouse, where I work.
Super. Okay. Up next is Shanika Dickerson and Dr. Bevel, and they're going to tell us a little bit about them.
Okay, well, I'm Shanika Dickerson. I am a dental hygienist at Fort Worth Children's Dentistry. I have been here a total of 18 years. I am the hygienist. I take care of the kids and do all of their teeth cleanings, give them oral health instructions, answer questions that parents may have, which we're going to be doing here, deal with infants from infants up to teenagers. Overall, here at Forward Children's Dentistry, we just take good care of kiddos from all ages.
Yeah, and my name's Dr. Nelson Bevel. I've been in pediatric dentistry now for about 12 years, I think, here in Fort Worth for about 10 at Fort Worth Children's Dentistry. This is my boss here with me. And we've had the pleasure of taking care of a lot of kiddos in the Dallas-Fort Worth area. Just like Shanika was saying, offering preventative tips and different things like that to keep our kiddos healthy and a full range of wellness.
Super. Well, we certainly appreciate it very much that you are taking time from your workday to join us to answer these questions that we have collected. I will say for those who are watching, you can enter comments. StreamYard may prompt you to do a verification just so if you want your name or your profile identified, you can. If not, I think it just shows up as like a guest, a StreamYard guest. And we will check comments at the end. Also, I just want to say the information about Fort Worth Children's Dentistry and about Monkey Mouse will be included in the comments after. And we will be sharing this video across many of our platforms after we finish the live version today. Good. Okay, so let's get to it. I'm going to ask, we collected these from our Fort Worth Moms team, which is 40 plus women. And so we got lots of great questions that cover a wide range of things. And we're going to start at the very beginning of life. And a question that's asked often is, when is the best time for the first dental visit? Like, how do we get oral health started for our kiddos?
Yeah. The American Academy of Pediatric Dentistry and also the American Academy of Pediatricians recommends that first visit to be around the age of 1, so 12 months, or 6 months after you get those those first teeth in, which is normally around 12 months or so. And so we all recommend that, just to give parents some little tips on how to keep their baby's teeth clean, advice on toothpaste, including like using a small amount of fluoridated toothpaste. I know that was one of the questions that we wanted to talk about is there's no need to use a training toothpaste. You want to use a fluoridated toothpaste right from the bat, but you just use a very small amount, and you can kind of vary that amount as the kiddos get older and are able to spit and rinse. And so we give lots of tips, a lot of instructions on what to do during an emergency. We normally brush those kiddos' teeth lap to lap and show parents how to get those teeth clean at home and go over a lot of stuff. And then that way, when the kids get to be 3, 4, 5, if anything does pop up, a cavity or an injury or something like that, it's not such a new scary process.
Okay, good. That's interesting to know. All those non-fluoride toothpaste brands are going to be upset with you.
There's a lot of them out there.
Yeah, they have grown
Thanks for money.
exponentially.
Yeah.
Okay, so the next kind of question following up with that would be, there are a lot of things that go into kids' mouths in those early years. And that would be sippy cups, bottles, pacifiers, finger and thumb suckers. Like, what's your advice for moms, not only for their oral hygiene, but even Karen, I'm interested to see if you would have anything to say on this. Like, what should our best practices or good tips be for kiddos? I mean, who are going to have pacifiers and sippy cups and bottles and all those things?
That's a good question. As a speech therapist, I can only talk about how it affects their function. And so we always refer to dentists to talk about how it affects the structure of the mouth. But whenever a child, so all of those things can be necessary, and they're not necessarily a bad thing. But for example, a pacifier, when a pacifier is in the mouth, it keeps the mouth in an open position. And so as a young infant, pacifier is good because, or it can be good for a child because it promotes a non-nutritive suck, which then helps with a nutritive suck, which you need to expel liquid from the bottle or the breast. But at a certain point, it's important that kids start to explore things with their mouth. You can think about babies beginning to put their fingers in their mouth and chewing on them, not necessarily sucking them, but chewing on them and putting their toys in their mouth to explore. And those are all really important developmental steps for babies in terms of learning how their mouths work. But if the pacifier, for example, is in the mouth all the time, it's keeping their mouth in a static position with their mouth open and then their tongue sitting underneath the pacifier. So they don't develop those really good and really important movement patterns. They don't begin to explore their tongue moving from side to side, as they're exploring more in a more mature way with things that they're mouthing and biting on. It also keeps their mouth in an open position. And if you think about it, for feeding and for speech sounds, having their mouth in a wide open position is not necessarily a natural position. And so it can get in the way of things like lip closure over a cup or over a straw when we introduce that later. Also, in terms of speech sounds, we don't really make any sounds with our mouth open. All of our sounds are made with our mouth a little bit more closed, often touching, our lips touching, or our tongue moving around our mouth, often up to the roof of our mouth. So in the case of a pacifier, if that pacifier is in the mouth longer than it should be, and for extended periods of time during the day, it can impact how the child is using their mouth, which then potentially could affect feeding or speech.
Yeah, I agree with you completely. We try to recommend stopping a pacifier around 3 years old. That way, up until that age, very little damage can be done those teeth won't flare as much, or that bite won't be as open as it would be on a kid that sucks their thumb, or a pacifier habit over the age of 3. And so 3 is normally that age where you kind of want to start having that discussion with your kid about donating that passy to the tooth fairy or something, and you can also start discussing getting and working on finger habits too around that age.
It's all really interesting information because, just in like mom culture circles, I was expecting you to say a lot about cavities. And there wasn't anything about cavities with sippy cups and bottles. So,
Well, yeah.
Well, yeah.
So that is the thing. We want to discourage nighttime nocturnal feedings with the bottle, especially. But even breast milk can cause cavities if you are consistently nursing throughout the night, because the kiddos will go back to sleep, their mouths will dry out. The bacteria that causes cavities can really start wreaking havoc on the teeth, and then that becomes a cycle. And so you want to discourage nocturnal feedings, or feeding ad nauseum throughout the nighttime, and stay on a pretty strict schedule with either bottles, sippy cups, or even breastfeeding.
and I'm going to assume that you mean after like an infant is past the point to where they would need nighttime feedings for nutritional value. When you're very young, you have to have nighttime feedings as just part of their typical growth. So I'm assuming you mean like later down the road.
Yeah, around 12 months. Yeah, after
Okay.
that. Yeah.
So Karen, I want to ask you a follow-up question. What are other ways that maybe like dental health issues or habits that we have, how can that impact like speech and like the function of the mouth?
I can answer it a couple different ways. I actually want to go back and talk about sippy cups for just a second, because I know that that's as a big question that a lot of parents ask me, because there are different kinds of sippy cups. So this kind of answers that question. There are the no spill kind of sippy cups where you turn them over and the child really has to suck hard to pull the liquid up. And then there are the sippy cups that maybe are not truly no spill all the way. You can turn them over and they're going to drip out. So they're not going to create a giant mess around the house, but they're going to be you don't have to suck the liquid out. So they're not completely no spill. Those sippy cups that you really have to suck liquid out of, or maybe you have to bite and suck at the same time, those kind of sippy cups generally are not as good for a child's development in terms of speech and language, because they are using an immature oral pattern. So whenever you are having to really suck liquid out of a sippy cup, you're using the same motor pattern that you're using whenever you're drinking out of a bottle. It's more of a suckling pattern where the tongue is going forward and backward, and there's not a lot of stability for the tongue. Versus if you're drinking from an open cup, or if you're drinking from a straw, not a straw where you have to really suck hard and like bite and suck at the same time, but a regular straw, it tends to develop a more mature pattern with your tongue. So where the tongue is moving more back in the mouth during the swallow and the tip of the tongue is elevating, versus a whole tongue movement forward and backward, which is what you get with a no spill sippy cup or a bottle. So that would be one way that oral health and oral habits, I would say, can affect speech and language. And then just if we are losing teeth, if you have cavities and you're having to have teeth pulled, that can affect the airflow through the mouth. And so then it can distort sounds. So that would be another way that oral health is connected with speech development.
And I have My sources have told me that this is kind of a hot topic of late, that's sort of kind of emerging about chewing, swallowing, tongue placement within the mouth into relationship with the tongue, even kind of going into teeth grinding and that kind of thing. So, what signs should parents be aware of when it comes to issues of tongue placement, chewing, swallowing, grinding? I know this is like a whole host of things I'm asking, but like, what should parents just consider normal? And then what should parents look for to be like, maybe we need to go see the dentist about this, or maybe we need to follow up with someone who can help kind of in the function of the mouth?
Yeah, so talk about teeth grinding. Teeth grinding is kind of considered a normal thing for a lot of kiddos. I think about 30% of kiddos will pick up that habit, and we don't really know why. We have some speculations. One is seasonal allergies really contribute a lot to teeth grinding in kiddos. The development of their permanent dentition or even their primary dentition coming in, kids will tend to start grinding more as things start getting loose and everything's really kind of settling in, like their 6-year molars or their front teeth are erupting. We know that stress and anxiety has a good play in teeth grinding, just like it does in adults.
Yes.
But fortunately, there's not a lot of treatment options for grinding. But also, fortunately, there's not a lot of damage that can be done from a kiddo grinding their teeth. And so we don't really worry about it, especially nocturnal teeth grinding on kiddos too much. It's just kind of a habit that some kiddos, but like I said, about 30% of kiddos will pick up. And I think it's just to stress out the parents more than anything. But yeah, it's a very normal habit that many kids do.
Yeah, I see a lot of that here in the office for sure.
Yeah.
Lots of that.
That's good to know. You've probably just eased some fears. And
Yeah,
is it typically something they grow out of?
It is.
Yeah.
So we think that most kiddos grow out of it around 8 or 9 when those permanent molars do come in, especially once they're in occlusion, meaning when your kiddo bites down, the teeth touch. Once those permanent teeth start touching, most kiddos will stop doing that. If you have a kid that's a grinder too, you kind of really look at their sleeping patterns. Make sure they're sleeping soundly throughout the night. You want to see if they're sleeping with their mouth open, or if you perceive any like sleep apnea or some restless sleeping. Do your kids seem tired in the morning? You may want to kind of look into that too, and make sure that when we're breathing, when we're sleeping, that all the breathing things is going okay.
Okay, good to know. What about kind of moving up in the age range a little bit? What is your suggestion for, okay, so here's a personal story, right? I just do these things so I can ask my own personal questions. Um, I have a kiddo who the majority of her permanent teeth came in behind her baby teeth, and she just has baby teeth that hold on for dear life. I mean, at this point, we're up to 8 teeth pulled, and I literally have an order. We're about to get into orthodontics to have 3 of her baby molars pulled, because those are also looking like they're not coming straight out. So, what are your tips for parents when they start to see that permanent tooth popping up behind the baby teeth?
So here in the office, we see that's a common thing as well. Most of the kiddos that we see, for the most part, what happens is the permanent tooth comes in and it dissolves the root of the baby tooth. So if that permanent tooth does not dissolve that root, then you're going to have that baby tooth that's going to be retained. If it's one of those that Dr. Bevel or one of the doctors here sees that it's just no way that tooth is going to come out, we definitely will do extractions here. And some kiddos, like I said, that's just a common thing that we see. Some kiddos, just the way that their teeth grow in, they just that root does not dissolve out. And so extractions are the the only way to necessarily get those out in most cases. So I don't know, for you have anything to add on that?
Well, Emily, like
Should-
when parents see, say, those first two baby teeth that usually fall out are the lower incisors, central incisors. When you see permanent teeth that pop up behind that, that can be a good indication that your kid has what's called a tooth arch discrepancy, where the size of their teeth and the size of the arch, the dental arch, will never add up mathematically. So the teeth are too wide and the arch is too small. So when you were explaining about your kid having that, I assumed that maybe they have a crowded dentition and they'll need ortho. Yeah.
Very crowded, top
Yeah.
and bottom. She's a 5th grader, and orthodontics are in her near future.
Yeah.
I mean,
So
it's just for like really layman's term here. Her teeth don't fit in the size of her mouth. Like she
exactly.
just has a very petite, just jaw and like frame within there. And so, yeah, we're gonna have to do some
Expansion.
Yeah.
revising of
Yeah.
that.
Yeah, that's a good indication. When you see those multiple sharp rows teeth, maybe you're going to need some
Yep.
early orthodontics.
Yes, that is a 100% here at my house. What about also like dental care in sports as kids get older? Some of the questions that popped up is like, what mouth guards should they always wear mouth guards for any sport? How do parents handle it when there's injuries? How do you do sports with braces? Like, what are your best tips for keeping things less traumatized?
Yeah, so I'm just coming off of a call of being on call for cooks. And I think I went in about 4 times. All were baseball injuries, which for some reason the only sport that doesn't require a mouth guard. But if your kid's playing baseball or softball, just have them wear a mouth guard, especially if they're out up to bat or pitching or something. But while those kids are developing, we don't want to necessarily make them an expensive permanent mouth guard because everything is changing. So I would just invest in something from Academy or Walmart that you can boil and bite into it, and then encourage your kids to play it. Soccer, any contact sport really. Football players especially, they're going to have to wear them during the season. So you might as well start implementing those behaviors and those habits as early as possible. And if you knock out a permanent tooth, grab the tooth, put it in a glass of milk or even saliva, and call your dentist immediately. They can be reimplanted.
Definitely.
Okay, thank you for that
Mhm.
tip. Try to find the tooth, whatever
Yeah.
you do. Yes.
Yes.
Yes. So
Mhm.
in that case, what you're saying is that you mentioned that you're on call for children's. Is in those instances you really need to go to an ER. You don't call your local dentist office,
No,
right?
call your dentist first. If you
Call
have
your
a
dentist
dentist that
first.
you can get a hold of, or in our office we take call 24/7.
Okay, great.
Call your dentist if you have a dental home. Call them first, and obviously stay out of the ER if you can. But there is always a pediatric dentist on call at
Okay.
Cook if you need him.
Yeah. Okay, that's good to know. So first call, and then you can kind of triage from there of what the
Hmm.
best thing to do is. Okay.
Hmm.
Karen, I want to ask another question for you as we're kind of talking about kids aging and really getting into elementary school and, other older ages. Um, what sort of like warning signs do you want parents to look for when they may need to get some speech therapies, whether that be like we were talking about chewing, swallowing, talking? Because, I mean, you don't really, I guess maybe what am I trying to say? Notice a lot of differences between possibly your child and their peers until they kind of get into elementary school. So, what are your tips and kind of warning signs for parents?
Well, as a speech therapist, we work with kids. We work with kids with articulation issues, which is how the speech sounds. We work with feeding issues, which obviously is about eating, and then we work with language issues. Interestingly, more of our referrals for speech tend to come before they hit elementary school, because if you're just not understanding your child well, by the time they hit elementary school, you should be able to understand all of their sounds and have a conversation and really be able to understand everything that they're saying. So at around 2 years of age, the child should be about 50% intelligible to somebody they don't know and about 75% intelligible to people who are familiar with them. By age 3, people who are familiar with your child, like family, teachers, close friends, close adult friends, should be able to understand most of what they say. So in elementary school, there might be a few speech errors that are hanging out, like sometimes S, where the tongue protrudes forward through the teeth so that there's a lisp. That might be something in elementary school that we would need to clean up. And maybe that child didn't need speech therapy until that point, but they're hitting elementary school. And usually this would be picked up in kindergarten. Maybe their S, maybe the L sound, maybe the R sound, or the TH is one that kind of takes a little bit longer to come in correctly. But we have norms where, at different age levels, you should be able to say different sounds. So by the time a child is in kindergarten, we should be able to understand everything that they're saying. They might have a few speech sound errors with like S, R, L, or TH, and those should begin to be clearing up pretty quickly. So if you can't understand your child very well by school age, they should be in, you would want to consider a speech therapy referral. And then if those speech sound errors are not beginning to clean themselves up, you could talk to a speech therapist either at your child's school and ask them, when these errors should clean up, or you could do an evaluation at some place like Monkey Mouse and we can let you know.
Good information. Okay, so going up a little bit to older kids, and I may or may not be asking this again for my own personal benefit. But what do you do when you have the kiddos who are getting into that tween age, kind of preteen stuff? And I don't know what it is about this age and hygiene, but they don't like to care for hygiene. It just becomes like an annoyance to them. It's kind of the graduation from the parents really being charged and doing all of that, and then the kiddo trying to take some responsibility. But what about when you don't have a kiddo who is brushing their teeth very well or brushing their teeth at all? I find myself having to check if it's wet, like this is just kind of an issue. You think, oh, this would be a problem with the little kids, but I'm finding it's a problem with the older kids. What are your tips rather than a come to Jesus talk about oral health?
Every day.
Yes.
Shanika, you take this one.
So yes. So it's what we tend to do is a lot of positive reinforcement all the way around. Always encouraging them when they come into visits. We are always reviewing their brushing with them and try to make them aware of the areas that they're missing and the things that they're not doing. I even will say, hey, well, if you can't do it on your own, we're going to have mom check. And it's like, I'm 13. Why is my mom checking my teeth? Or 11, 12 years old. But sometimes we just have to put that into their minds that if you can't do it on your own, then you're going to have to go back to the days when mom or dad has to check for you. And sometimes that'll get them on board. Like I said, a lot of times with me and my patients, what I do is I make them aware. Then we try to, do the whole talk of peers and, you're getting of a certain age. And these are things that, you're going to have to be doing on your own. And making sure that you're brushing well when you're going to school. You don't want, your friends to have those conversations about, not having clean teeth. I think the biggest thing for a lot of patients is just making them aware of what they're missing. We do have tips that we can do as far as sending home disclosing tablets to kind of give them areas so that they can see it for themselves visibly. We do a lot of OHI with hand mirrors and let them see, and we demonstrate how to floss, how to brush properly. And a lot of kiddos, like I said, they don't understand the process of how to maneuver and get into those areas. And so that's the biggest thing, is just educating them on how to get into those areas so that they can brush better.
Good tips. Okay, and let's talk a little bit about braces. And for my family, we're about to get into that. And something that I'm realizing is that orthodontics today, it's not the same as whenever I had orthodontics XYZ, we won't say how many years ago. I'm personally a little bit offended that they don't have to do all that goop in their mouths and sit there for like 30 minutes and trying not to gag, but that's beside the point. My one question would be like, what can parents expect out of orthodontics for their kiddos now? And then Karen, I'd ask a follow-up question with you. Are orthodontics any type of issue for like speech issue people, kiddos who might have food issues, eating issues? If you could kind of follow up with that as well. We'll start with Fort Worth Children's Dentistry.
Yeah, so orthodontics for everybody looks a little bit different. Some don't need any braces, some need early intervention, like we discussed. If you start seeing severe crowding in your kiddo, you can relieve a lot of that through early intervention with expanders, starting, increasing the width of that arch with those expanders or different things. So normally, and I think the orthodontic board wants people to be seen by an orthodontist, a board certified orthodontist, around the age of 8. That doesn't mean you're going to start ortho, but it's kind of a good idea to start getting a picture of what that will look like for you guys. There's a lot of cool things happening in ortho too now, where expanding that arch increases the air that you can take in. It's improving people's airway at nighttime, sleeping or even speech. And there's a lot of cool things that can come from early intervention with orthodontics. But then there's most people will benefit from ortho once they lose all of their baby teeth. So that's why we normally see teenagers with ortho, because they've lost all their primary teeth. They have a full set of permanent dentition, and then we're just putting teeth in the right places. But there's plenty of kids that need more than just straightening of teeth. We've got to actually make space, and that's a good indication for early treatment.
As far as speech therapy, teeth that don't fit well together can impact chewing. It could potentially make chewing uncomfortable and less efficient. So if we see that that's going on, we would definitely refer on to a dentist, because just us working on chewing by themselves, by ourselves, may not be as effective if the teeth are not fitting together very well. And then sometimes whenever kids get their braces on, a kid who is very sensitive to things in their mouth or the way things feel can sometimes be a little bit freaked out by having the braces in their mouth. If we happen to be seeing a child already for other issues and that's an issue, we can help them work through that, and we can help them feel more confident and more comfortable eating and chewing with this extra equipment in their mouth.
Emily, I want to add, when you're ready to look for an orthodontist, make sure you kind of do your research and find somebody that is actually an orthodontist, a board certified orthodontist. There's lots of great dentists out there that do a lot of different great things, but try to find somebody that actually specialized in that dental specialty.
That's for sure. We use a certified orthodontist, for lack of a better word, and it was interesting for me to learn, because she did have a consultation, like you said, around age 8 is probably true, and we see the benefit of kind of having the early intervention, because in the long run, it will actually mean that she requires less orthodontic treatments than trying to wait until her palate's fully established,
Yeah.
etc. So, yeah, it is a new way of thinking for me to see like the orthodontist wanting baby teeth pulled, but he's doing that so that we can get things set up the best possible way we can when
Yeah.
she, in about 9 months, will have those put on her teeth.
And you can avoid extracting permanent teeth,
Yes.
which is good.
Good point. Okay, we have like 1 minute left, so I'm going to ask some fast questions. Okay, this one may not end up being fast, but here's one topic we didn't touch in the younger years is lip ties and tongue ties are like all new moms are worrying about that. So what would you say to a mom who's concerned her kiddo might have a lip tie or a tongue tie?
Yeah, you're right. It's a very, very common thing. I think the incidences of the diagnosis of lip and tongue tie has gone up almost 900% over the recent years, and we don't know why. There's a new emphasis on breastfeeding, and we all know that breastfeeding is the gold standard, but it can be a challenge for a lot of different people, and so there's a new emphasis on breastfeeding and breastfeeding for an extended period of time, and so the diagnosis alone has gone up 900%. The procedure of clipping lips and ties has gone up like 830%, and that is only in inpatient children. So it is a hot topic. Are there kids that benefit from having their lip tie or their tongue tied corrected? Absolutely. Is it being done too much? Yes, probably so. We've always been taught as pediatric dental specialists that if you don't require that lip surgery or the tongue surgery at infancy, if you're not gaining weight, you're not being able to eat properly, go ahead and do it then when the child's very small. Anytime after that, the kids will usually tear that lip tie, or they normally learn or work with speech therapists to use their tongue appropriately to find those words and use that tongue to make the right appropriate sounds, so that you can avoid a quite uncomfortable and messy surgery. But the incidences on it have gone up like crazy, but I want to hear what Karen has to say about it.
We are generally fairly careful in whether we refer kids for a tongue tie release or a lip tie release, because it's not, if a child isn't speaking well, it's not necessarily because of that, even if they have a tongue tie or a lip tie. As a speech therapist, we're going to look at how it's affecting function. And so if their speech sound errors do not appear to be impacted by that, we're not going to refer them on for that procedure, because it is a little bit uncomfortable, and there's a fairly involved retraining of the tongue that needs to happen after that procedure. So yes, we're going to primarily look at how their tongue movement and their lip movement is impacting speech and how it is impacting feeding. And then we also look at how it's impacting them at rest, which can affect sleep and breathing issues too, which we again would refer out if we had concerns about those things. But we are going to look at how it's affecting function rather than looking at it as something that is going to fix a speech issue or a feeding issue, because even with that procedure, it's going to involve a good bit of intervention to make that correction to the functional movement. So,
yeah, that's great to know. Thank you. That was super helpful. Okay. Last kind of two quick questions. So you already answered my question about training toothpaste or regular, but see, all of us 80s and 90s kids were like scared to death to swallow fluoride. So the thought of us putting fluoride, having our 4-year-old brush with fluoride, like what if he or she swallows fluoride? Like you have to tell us, how bad is swallowing fluoride toothpaste?
It's not bad at all. So, the World Health Organization has named fluoridating our water supply one of the top 10 best things to ever happen to public health. It's like number 3 on the list because of the dramatic decrease fluoride has shown on decay. So I grew up in Hereford, Texas, in the Panhandle, and we naturally had a ton of fluoride in our aquifer that we drank, and it's called the town without a toothache because nobody had decay, and we're all ingesting it obviously in our water, and we're all fine, so, for the most part.
So I don't need to hover over my first grader to make sure she's not swallowing too much.
Not at all. So that's what we were discussing. So when you have that infant, you have the first sign of a tooth, use a small smear of fluoridated toothpaste to brush those teeth. as they're getting older and older, all anyone needs is the size of a pea. We don't need any more toothpaste than that. So yeah, so whatever you end up ingesting it's a normal and healthy amount. Now, if you ate a whole tube of toothpaste, call poison control. But
Okay.
anything between that and the whole tube is going to be okay.
Okay. I'll try to get my first grader to like slow down on the squeeze a little bit because it's
Yeah.
usually quite a bit of amount. But anyways. Okay, last question. Regular toothbrushes or electric toothbrushes? What's your preference?
You get that one.
Okay. For me, myself, I prefer an electric toothbrush. For patients, I just recommend whatever they will use first and foremost. Some kiddos tend to do better with electric toothbrushes, especially kiddos in ortho. We really try to recommend them use an electric toothbrush. Smaller kids, little ones, sometimes the heads are a little bit bigger, so it's kind of harder to use those. But for the most part, any kid that loves or will use an electric toothbrush, we prefer those. They definitely can get in and kind of get it and work a little bit more. And they tend to not press as hard because a lot of those have the sensors on it that can restrict them from brushing really hard, which we don't want to do. That could cause recession and damage to the teeth from pressing hard on the toothbrush. So for the electric toothbrushes, I love those. And like I said, whichever they choose to use, as long as they're getting in and doing the mechanic work and brushing and getting the gums and teeth really nice and clean, either would be fine, just as long as they're doing a good job with it.
Yeah, Emily. So a lot of kids don't develop the dexterity to brush their teeth very well until they're much older.
Yeah.
So like we have kind of a rule: if your kid can style their hair in a way that you think is appropriate for them to walk out of the door, then maybe their dexterity is up to snuff where they can twist and turn that toothbrush to get up into those good angles. But by and large, we recommend parents help brush kids' teeth literally till they go to college.
Still, yes.
Just take a peek in there every once in a while.
Yes.
Yeah. I hear you. I understand what you're saying. I'm living this right now.
Yeah.
Well, last call. Anything you want to get off your chest or share? Something popped in your head? Nope.
Not
Well,
for me.
thank you so much for taking time again from your workday to be on this panel for us. We will, like I said, post information in the comments. We're also going to put this on our YouTube channel. We'll put it on Instagram. We're going to create an article and we'll have links in there as well as some other resources that we have about dental health, oral health. We even have some, I think, an article or two from Monkey Mouse we'll include. And so, yeah, thank y'all so much. I can do this real quick so I could say I did it. You can find all this information and more at fwmoms.com. All right. Thank you again so much. I appreciate it.